Okay, everybody, we're about halfway through this semester, or a little bit beyond that now, coming down into the home stretch. So we're going to be doing musculoskeletal system today. Personally, my favorite system, but that's what we're working on. A few housekeeping items. I noticed from the last quiz that the scores were very good, much better. The matching part was much better. I think that that's really what helped, so I appreciated everybody's feedback and participation in the discussion board on that. There were a few terms that seemed to throw the majority of people off. These are the terms here: plazo, geno, morpho, blasto, phago, and xeno. So just to briefly review those, plazo is development and formation. So this is like aplastic anemia, the lack of formation or growth of a cell, which results in a red blood cell in particular, which results in this anemic state. Not to be confused with geno, which is to become or produce. So our genetic material determines what we become. So those terms commonly got confused, and they're not the same terms, so make sure you understand the difference. Morpho, of course, is the shape of something, so morphology or your morphotype is how you look, in the shape of how you look, or the study of shape is morpho. And then blasto is young, and hopefully you remember the cell chart that was in the last lecture, right? Everything starts as erythroblast or lymphoblast. These are young immature cells in the bone marrow. In fact, they measure the production of those cells when you're getting to an infection state. A lot of times you'll get a lot of lymphoblasts released into the circulation because the body's trying to produce white cells faster, and there's not enough time. So blasto is young, or like a blastoma is a young tumor. And then phago is to swallow, right? And so last week we talked about phagocytes, and these are immune cells that swallow things. And then xeno, and this comes up in multiple units, so make sure you understand this. This is foreign or strange. So we could do either of those. So I appreciate all your feedback from last week, from midterm feedback. It does make me better. I look at every single feedback. I consider those things. One of the things, a couple of times I had some students asking for help with pronunciation, so I'm going to try and post pronunciation guides in the announcements. So I'm hopeful to have that for you by the end of the week this week, and then every week thereafter. Also, if there's things you want in the PowerPoint lectures, let me know, and I can try and include those if they're reasonable requests. The midterm is coming up, so make sure you're preparing yourself for the midterm. It is comprehensive over the last several weeks, but it primarily focuses on the urinary system, and that's the system you'll be studying the week of the midterm. It is weighted heavier than quizzes, 10 questions. It's multiple choice format. It's very similar to how the final will be formatted, and I will be posting some practice questions so that you guys can get used to that, because it's not the same format as the quizzes. As far as the musculoskeletal system goes, it's made of muscles and bones and their attachment to one another. Bones, of course, the term for that is osteo, right? And joint is arthro. That's where two bones meet each other. So if you have something like arthrocentesis, you're drawing fluid off of the joint there. Muscles attached to bone with a tendon, and ligaments stabilize bone and joints together. You have long bones, short bones, irregular bones, and flat bones in your body as far as the morphology, right? The shape of the bones goes. Long bone anatomy is made up of the epiphysis. That's the very end of the bone. You can see this chart. Hopefully you can see that, and I'll post it so you can blow it up or whatever you need to do. The metaphysis is the long part of the bone, or the part. So the epiphysis is here, the metaphysis is here, and this is the diaphysis, which is the long shaft of the bone. The types of bones that you have, all bones are like a hard-boiled egg, I say. Some are more dense than others, but there's the strong outer layer, which we call the cortical bone, and then there's the medullary inner spongy cancellous bone that's on the inside. And so you need to know cortical is this outer layer, and medullary is this inner inner layer, right? And then the medullary canal contains bone marrow, which is myelo is the medical term for that. And of course, you can get myelodysplastic disorders, which are disorders of the bone marrow producing types of cells, and certain types of cancers come from those. So here's your axial skeleton. So axial is, this straight line, this very inside skeleton. It consists of your skull, which is your cranium, right? And then your spine, which is cervix, right? That's your cervical, is your neck spine, but also used in female anatomy for the cervix uteri. So make sure you understand that cervical is used in both of those places. And then you've got your thoracic spine or thoracic spine. That's where your chest is. That's your thoracic cavity. Of course, we learned this before when we talked about cardiovascular, the thoraco, right? That's where, your heart and your lungs, your ribs are all around there. They attach. They're part of your appendicular skeleton. But the costovertebral joints are where your ribs attach to your spine. And that's all in the thoracic cavity, or the thoracic part of your spine. And then you've got your lumbar. This is your low back, and lumbo also pertains to your loins. So make sure you understand that, helping your navel, marrow, and bones strengthen the loins and in the sinews, right? So that's a lumbo, right? And then sacrum, and then coccyx, thoracic, right? Thorax. Make sure your sacrum is down towards the bottom. If we go back to the last slide, this is your sacrum here, and then your coccyx is like this old the tail that used to be there. If you speak to evolutionists, right? And here's your coccyx type of part of your spine. And then your ribs, like I said, they're attached here. So here's your ribs. They're actually part of your axial skeleton. I think I said appendicular earlier, so pardon me on that. But your ribs, and those are costo. So make sure you're costovertebral, right? And then here's your sternum, which is their part of the ribs. So your spine has a normal curve to it, but sometimes curves become excessive, and these lead to different kinds of pathology. So this we call a kyphotic spine. This we call a lordotic spine, and this we call a scoliosis or scoliotic spine. So these have different curves, right? The lordotic is where you get this pronouncement of the abdomen, and kyphosis is the hunchback spine. So what pathology is this? I'll leave that up to you, but hopefully you can figure out from the previous picture what pathology we're dealing with there. Right, so in your spine you have lamina. You can see them here. It's this part of the spine, and a common procedure that you often hear is laminectomy, right? So here you go. This is pre-op, right? You can see where that nerve is getting pinched by the bulging disc here. And so after laminectomy, they remove the lamina. They remove this part right here, and then you don't have that compression. So that's common laminectomy, common procedure. To help you understand about the lamina, right? And then you have your appendicular skeleton, right? Your pectoral girdle, your arms, your hands, and your fingers. So that's all up here. This is of course, your pecs, right? And your pectoralis major and minor, and this is your pectoral girdle, right? Here you got your clavicle, and then your arms and your hands and your fingers, which are dactyl. So are your toes. So make sure you understand that toes and fingers are dactylo, right? I have a patient right now who has polydactyly, which is an extra toe that we're going to take for surgery as well. So there's your and then you've got your pelvic girdle. This is lower, right? Pelvis, legs, feet, and make sure you understand that feet has multiple combining parts: podo, pedi, pedo. So make sure you understand that as far as your foot goes, that all those terms apply. As far as other parts of musculoskeletal, you have fractures. Fractures are classified as open, closed, green stick, or stress. And an orthopedist is somebody who works on straightening bones, so they primarily deal with the musculoskeletal system, fracture, and management of tendons. And that's primarily what I do in the lower extremity. And so this is an open ankle fracture that I took care of a while ago. So infections in this system, osteomyelitis, right? This is infection of the bone, right? Osteo and myo, there's your medullary, your bone marrow. So infection throughout the whole bone. This can lead to a septic state where we have bacteremia, which is bacteria in the blood. Osteoporosis is this weakening of the bone. Arthritis is inflammation of the joint, and then fasciitis is inflammation of the fascia. And fascio means band or fascia. Make sure you know that. And you can see that here. Common. Lots of people have heard about plantar fasciitis, but it's this fascial band, and you get this tearing and this inflammation back here in the heel. As far as the spiritual thought, since we're dealing with the musculoskeletal system, I think we talk about strengthening muscles and strengthening that system a lot. And so as I was thinking about that, I thought about how do we strengthen our faith. Well, I think the first thing that we have to understand that faith needs to be centered in Jesus Christ. That's what we need to have faith in Jesus Christ. There's a lot of things that people try to put their faith in. They try to put faith in football teams. They try to put faith in the theories of men. They try to put theories and faith in their friends. But when our faith is centered on these other things, inevitably that will crumble. Teams will lose. People will not have all the answers. Things will happen. People are imperfect. So when our faith is founded in those theories and those ideas, eventually that all crumbles. So the first principle, I think, in understanding how to strengthen your faith is to be centered in Jesus Christ. He's the one with all the answers. He's all-knowing and all-present, and so we need to have our faith centered on Him and on His gospel. The next thing is that we need to practice, right? This is a gospel of exercising faith, of doing things. And so I will take you back to Moroni 10:3-5, which talks about real intent, which I've been reading about myself a lot lately. And ask yourselves, if you're wanting to strengthen your faith, do you have the real intentions of strengthening that faith? Meaning, are you willing to follow through with the things that need to be strengthened? When the Lord, when you get down and you say, what lack I yet, which was asked in conference a while ago, and you get an answer of humility or prayer or honesty or whatever, are you willing to follow through and do those things? That's how our faith gets strengthened. When you get a feeling that, hey, so-and-so needs some help, do we act upon those things, or do we brush them aside? And I'll say, if we brush them aside, then we're not allowing our faith to get stronger. Now, as it pertains to being a student and learning, do we have real intent, and do we center our faith in Jesus Christ when it comes to learning about things? I hope we do. I hope we realize that as we put God first and then apply the principles of learning that we've talked about a lot in this class, that our faith can become stronger, that we can receive answers, and as we act upon those answers, you can realize that God is involved in the learning process, and that the atonement can help you overcome some things that are deficiencies for each person, and each person has their own separate trials and weaknesses that they have to overcome, and God understands all of those, and you can overcome all of those through the atonement. I love the quote that I was just listening to. I think most saints in the world understand that the atonement is for sinners, but really, in reality, the atonement is for sinners and for saints, for anybody who's trying to get better, who's trying to be better tomorrow than they were today, who's exercising their faith and trying to get stronger. I hope you'll do that this week. I hope that you'll believe that all things are before God's face, and that He sees all things, and that He knows all things, and that He can help you with all things. And if you'll go to Him with real intent, that these things will get better for you. Have a wonderful week. If you have any questions, please send me email, text, phone call. Happy to discuss these things with you.